Hello, I'm Cynthia Edwards, and this is my presentation on culturally competent nursing care of the Mexican American patient. Mexican Americans are defined as those individuals reporting Mexican culture heritage who self-identify as permanent residents of the U.S. regardless of legal residency status. The nation's Latino population is diverse. Represented among the 51.9 million Latinos in the United States are individuals who trace their heritage to more than 20 Spanish-speaking nations worldwide. Mexican Americans dominate the nation's Latino population. Nearly two-thirds of the U.S. Hispanics, or 33.5 million, are traced their family origins to Mexico, according to a Pew Research tabulation. Mexican American health beliefs and practices discussed in this presentation are from traditional perspective. We will discuss how cultural values affect Mexican American healthcare decision, address diverse learning, teaching, and support needs of the Mexican American community, describe culturally based traditions, health beliefs, values, attitudes, and behaviors, discuss treatment issues characteristic of the Mexican American population throughout their lifespan, and strategies for development of culturally appropriate verbal and nonverbal communication skills in the care of the Mexican American patients. Mexican American beliefs related to healthcare. Mexican Americans have faith that God will take care of everything and view the doctor as divine in origin. Sometimes will not report ineffective treatments or side effects for fear of disrespecting the doctor. Direct eye contact is frequently avoided with authority figures such as healthcare providers or those perceived class differences. Family members may demonstrate respect by standing when the provider enters the room. Silence sometimes shows lack of agreement with the healthcare plan. Touch by strangers is generally unappreciated and can be very stressful or perceived as disrespectful. The patient may prefer to be examined by the provider of the same sex. Handshaking is considered polite and is usually welcome. How the Mexican American defines health and wellness. Both physical and mental illnesses may be considered as an imbalance between the individual and the environment. Emotional, spiritual, and social factors influence health and disease resulting from hot and cold imbalances. The Mexican American population often views the mind and body as one, interdependent in a state of both health and illness. Income, acculturalization, and education are factors that contribute to the perception of health. Individuals suffering from poverty view survival as their only concern, while others believe in fitness and healthy eating as a part of a good health. Mexican Americans have a strong belief that life is in God's hands. Natural remedies using herbs and viewed as the most effective way to heal illnesses. Folk healers are perceived to have God's given ability to heal using herbs, oils, massage. Sometimes a person may apply remedies while seeing a physician. It is important for healthcare professionals to make an attempt to elicit the patient's beliefs and attitude about illnesses. Some suggestions to facilitate the process are maintaining an accepting attitude. Let the family and the patient know that their ideas are valued in developing a care plan. Ask the patient what they think is wrong or causing the problem. Ask the patient what he thinks there may be some ways the doctor may not know about. Ask if anyone else has been asked to help with the problem. Ask the patient what worries them most about their illness, and ask them why they think they are ill now. Honoring the significance of family values and roles is an important component of nursing care and of consultation with Mexican American families. In particular, culturally competent nurse would elicit family participation during patient teaching, family support for the patient in healthcare decision making, using language and expressions familiar to the Mexican American family may increase family adherence to health teachings and treatment protocol. Nurses should expect and support presence of extended family and their participation during a loved one's hospitalization. Mexican American culture, women typically, the eldest daughter becomes the caregiver to the family members because of the cultural priority of family. Many women believe pregnancy is not an illness and prenatal care is unnecessary. Others seek prenatal care for reassurance of fetal well-being. Barriers to prenatal care include fear of the healthcare system, financial constraints, and lack of transportation. The nuclear and extended family provides supportive and respectable environment for the pregnant woman. Women who are attended mothers are highly respected. The expected mother is discouraged from heavy work or harmful activities such as smoking, drinking, or drug use. She is encouraged to frequently rest, walk, eat well, and get plenty of sleep. It is common for the grandmothers to move into the nuclear family homes during the last weeks of pregnancy for weeks following delivery. Food cravings, known as antojos, failure to satisfy the craving by a pregnant woman is believed to be cause a defect or injury to the fetus. For example, a strawberry nevus may be explained as an unsatisfied craving for strawberries. After birth, there's a traditional 40-day period of recuperation for the woman, and she is cared for by female family members and expected to care for her newborn. Domestic chores are taken on by family, relatives, or friends. New mothers are discouraged from taking a shower for several days after birth and discouraged from getting out of bed for the first few hours after birth and then only to the bathroom. Americans are raised to believe that germs cause disease. American mothers are uncomfortable when people get too close to their infants. Mexican mothers, in contrast, may worry when strangers admire the babies without touching them. The very act that is believed to protect a child from illness in one culture is thought to cause illness to another. In the Mexican culture, to admire an infant without touching puts the baby and infant increased risk for mal de ojo, or the evil eye. It's a sudden downturn in physical and emotional condition of the infant or young child, and is believed to be caused by admiration or jealousy of a person with powerful eyes. The symptoms are fever, vomiting, crying, and weakness of the infant. Medical professionals should assess the patient for dehydration and infection without dismissing the mother's concerns. Children who assimilate into American culture are at increased risk for type 2 diabetes. Rates of obesity is higher for Mexican American adolescents. Mexican American high school students are more likely than their white peers to spend 3 or more hours a day watching TV, and are less likely than their white and black peers to be a part of an organized sports team. Children raised in poor or Spanish-speaking homes within a large household are at increased risk for delays. Pediatricians and practitioners must carefully gauge the social and emotional well-being of the Mexican American child in developmental surveillance and activities. Growth in cognitive and social domains unfolds independently for most Mexican American children, even when raised in economically poor families. Mexican American teens have a high rate of sexually transmitted infections, and teen girls have a high birth rate compared to non-Latino teens. Mexican Americans have the highest prevalence of metabolic syndrome. It's a clustering of cardiovascular disease risk factors that place them at higher risk for developing and dying from heart disease. 40.2% of Mexican men over 20 years old is obese, and 45.2% of Mexican origin women over 20 years old are obese. Nurses should involve family members in the care to encourage screenings and lifestyle changes to prevent or delay metabolic syndrome by making small lifestyle changes in diet and physical activity and how to stay physically active. Many Mexican Americans rely on their extended family and community and traditional healers to help during a mental illness crisis. As a result, thousands of Hispanic Latinos with mental illness go without professional mental health treatment. Culturally sensitive care of the older Mexican American patient. Mexican American elders are the fastest growing group of elders. Functionally, they become functionally impaired at a younger age than Anglo elders. They are reluctant to use home health care or hospice care and are cared for by family if possible. It's respectful to address older Americans by their last name, or senor for males or senora for females. They may prefer not to have a younger family member as their interpreter when discussing private issues like bladder or bowel or breast problems. Death is considered God's will. It is perceived to be a freedom from this life to a better life. Mexican Americans' religious beliefs has a big influence on the concepts of death. Many believe that the afterlife, believe in an afterlife in heaven. Family members would usually need time with the body in the hospital before it gets moved to a mortuary, and many want to help prepare the body with their rituals. Burial rituals are more common than cremation. The body of the deceased is dressed in special clothing. Families want to be around it overnight for relatives and friends to pray for the soul. Food may be served at the wake. Families sing religious prayers as the body is taken to the grave. Some may want to be buried in their homeland. Black is worn in honor of the dead. Meeting the healthcare needs of the Mexican American community. We should promote community level outreach programs to reach the Mexican American families. Use bilingual Spanish English outreach coordinators to provide health information in community centers, churches, and health clinics. Establish bilingual support groups for those with chronic health conditions and increase the number of Spanish-speaking providers. In summary, Mexican Americans believe that health is in God's hands. Natural remedies using herbs are viewed as the most effective way to heal an illness. Many use remedies while seeing a physician. The nuclear and extended family provides support and a respectful environment for the pregnant woman. Obesity, diabetes, hypertension, and hyperlipidemia, as well as mental illness, is common in the Mexican Americans. Healthcare professionals should utilize community resources to reach Mexican American population. The best way to improve communication is to increase the number of Spanish-speaking health professionals. Thank you for viewing my presentation. I hope the information provided helps in the care of your Mexican American patients. Best wishes to everyone in your nursing career.